we've taken a contrarian approach, and that sort of has shown some early success, right? So our approach has been that digital health literacy isn't the problem; it's actually product design that's the problem. I'll give you an example. Elderly, you name them, a billion across, I mean, a billion people, and whichever 90% of the elderly population. Over 100 million Indians age 60 plus are on WhatsApp. They're watching YouTube. They're making UPI payments. Sort of the challenge is what we sort of at least what we challenge our product teams. It's not about literacy because it's also because most digital therapeutic tools, including early versions of the ones we built, were built by young product teams for young users. And it was completely ignoring voice first user interfaces, vernacular interfaces, and culturally relevant nudges. So, what our thesis was stop blaming the user, start designing for them. And that sort of started to pan out a lot, and we started to get a lot of scale. The second was that the minute, this income being a barrier, right? I think what we found is actually shocking. I mean, and this is relevant, by the way, for the bottom of the pyramid. Income is a barrier, but if you take that out, actually, we found income isn't the barrier, prioritization is. Digital therapeutics hasn't earned its seat at the kitchen table. And the way I see this is these same elderly families, they spend on cable TV, they spend on religion, they spend on WhatsApp data packs, they spend on homeopathy. Whatever they trust, they understand they'll spend on. But in the value of the digital therapeutic, it's still unaffordable. So if a 100 rupee a month digital therapeutic plan can't beat a 1,000 rupee temple donation a month, because I'll donate 1,000 rupees to the temple, but I won't sort of spend that 100 rupees on the digital therapeutic. The issue, what we see is perceived value. It's not, basically it's relevance. Like we've not seen income beyond the bottom of the pyramid issue. And then the third is just we found that the real barriers are actually cultural. They're not technological, right? So there's this myth we have in India of the joint family safety net, right? That, oh, we're in a joint family, everyone's going to take care of each other. The reality is no one's tracking that same elderly person that who's living in the same household. No one's tracking their medication, no one's tracking their mood, no one's actually helping them with their frailty. So there's a very silent culture around aging, dementia, depression. These are just not things that we as a society talk about. There's no vocabulary to describe the problem. Health is not seen as a continuous issue. It's seen as episodic, crisis driven. Like you're healthy until you need to go to the hospital, right? And therefore, what we found is that cultural barriers exist much more than some of the others. Again, this is just me talking as a builder and as an executioner of trying to get these products in the hands of millions. And as we've reframed some of these problems, we've seen some success.